Hello again. Welcome to my YouTube channel, Just the Talk. I've done some videos on obesity. There were several of them. Also did some on insulin resistance. Also did one on exercise and high intensity intermittent exercise, etc. From that, I thought it would be a good idea to address a couple of things which have been becoming more and more popular to talk about. One of which is the lipoprotein A and lipoprotein B. Another one is, of course, visceral fat. This particular video, I'm going to talk about visceral fat. If you look at it, there are several people who have several opinions and many other stuff. I thought I would kind of touch the basis with this as to what is visceral fat, how can you know about it, what is wrong having too much of visceral fat, and how to lose it. Again, this is a large area. I'm not an expert in it, but certainly can talk about it with the whatever has been happening. We have known about visceral fat. The visceral fat is, viscera means the organs inside your belly, which includes, of course, liver and pancreas and stomach and many other organs. So there is a fat which is underneath your skin, which you can measure as a abdominal skin fold or the stomach skin fold. You can measure it on your triceps. So if you have ever gone to a gym in the past and they measure your percentage body fat, they take either the abdominal pinch, belly wall pinch, or the triceps, and they can measure it. So that is a subcutaneous fat, something which is underneath the skin. That particular fat is not as dangerous as the visceral fat, which is inside your belly. So the visceral fat is supposed to be active, and some people feel it is almost like a endocrine organ because it secretes several inflammatory markers and it causes your insulin resistance and increases the incidence of diabetes type 2, coronary artery disease, strokes, and many other stuff. It secretes many hormones, some of which are kind of known, but some of which are not known. Adiponectin, resistin, TNF alpha, and many others. And basically, these are inflammatory markers. So you have inflammation in many organs, and that can cause problems. As I said before, it increases the incidence of insulin resistance and is associated with probably metabolic syndrome, also associated with increased incidence of atherosclerosis, hardening of the arteries, and high blood pressure and type 2 diabetes. Certainly, it can reduce the life expectancy. So, targeting the visceral fat has become an important treatment option because it produces inflammation and you can improve your insulin sensitivity, reduce the incidence of coronary artery disease. As you can expect, the women have higher total body fat. The measurement of visceral fat is rather difficult in the past, and it is still. The best way would be to do an MRI, magnetic resonance imaging of the belly, and measure the intra-abdominal fat which is inside the belly, or a CAT scan, or there are newer techniques of DEXA scan. One of the simplest way to know would be there are formulas which are available on internet and you can look at them, where you measure your waist circumference, and waist to hip ratio would be one way to know it. The waist of 35 inches in women or more is not good. That of course indicates subcutaneous fat, and the hip is measured and then they do the ratio. So again, in men, 40 inches of waist would be the upper normal, 35 for women. Waist to hip ratio is different for different species, different races, including Indians or Asians. It is much more stricter to assess the risk. And then there is another way to measure is that waist and the thigh measurement. This measurement will take you out of estimation of subcutaneous fat from total body fat. There are machines and weighing scales that are available where you can measure the total body fat, and they are very reliable. So the measurement, if you're going to do and use the internet related formula, which includes your age and height and weight and waist and the thigh circumference, and calculate the visceral fat. The waist, of course, is taken up somewhere between the rib cage and the top part of the hip. So it will be just around or above the umbilicus or belly button. And the thigh is right where the buttock cheek is there. So those two measurements are taken into account when people are measuring it. Now that I have talked about the measurements, and of course the best would be the MRI or CAT scan or DEXA scan. These are non-invasive techniques that I mentioned. How do you reduce it? And it's kind of threefold. One is the diet and dietary inclusions of certain things and avoidance of certain things. And second would be exercise. I'll talk about quickly about the exercise first. Again, basically when you do the exercise, studies have been done to show that if you do bicycling 45 minutes twice a week, it is effective in reducing the body fat substantially, whether you lose the weight or not. Now the total body weight may go down, the subcutaneous fat will go down, but more so is visceral fat. 45 minutes cycling sessions with VO2 or a maximum oxygen consumption of 80%, and it's sometimes difficult for people who are out of shape to achieve that, would reduce your total fats by 48%. And your weight will go down and insulin resistance will improve. So that is one exercise. When you talk about diet and exercise, the diet is effective in losing weight more effectively, but the exercise is more effective in losing visceral fat. Out of exercise, the anaerobic exercise and the resistant training and the high intensity intermittent training that I mentioned in my previous YouTube video are the three different ones. As I said, VO2 max, that means maximum oxygen consumption, is important. When you exercise, if you can talk but feel short of breath when you're talking full sentences, that could correspond to 75-80% of your oxygen consumption. Again, if you cannot talk, that is higher. But moderate exercise would be when you can talk full sentences, but you can still keep up the pace. At that level, if you exercise, then the aerobic or high intensity intermittent training is almost equally effective, but you must do that. Resistant training is good for muscle building, but for losing the visceral fat, it is less effective. Again, I would recommend combining all. So that's about the exercise. Avoiding processed food and pure sugars or carbohydrate would be a great idea to do it. As far as food to select, and something which has been proved to reduce the visceral fat, are your highly colorful vegetables. For example, like tomatoes and spinach and carrots, sweet potatoes, they all have what is called carotenoid, and that is an antioxidant. It will help to reduce the visceral fat, and the studies have shown that when you increase intake of these stuff, it will definitely reduce the total visceral fat. The second thing which has been in the picture is the green tea. And again, the green tea is good. There are a couple of brand names that people recommend. My personal feeling is the caffeine and the flavonoid, which are there in the green tea, will definitely help to lose weight as well as lose the visceral fat. Again, they act as antioxidant, and caffeine is also good for that same reason. Not the antioxidant, but to stimulate certain things in our body. These two, the carotenoids and the flavonoids, will adjust some of the genetics that will spend or burn fat, reduce the effect of the genes that conserve or make more fat. So those two must be incorporated. So the carrots, the red pepper, the green peppers, the 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 sweet potatoes, spinach, these are all colored. That will be helpful, and incorporating green tea. Now, people talk about how much green tea, if you look at the content and can find out minimum 600 milligram per day of flavonoid in the green tea will help to lose the weight as well as lose the visceral fat. Weight loss, of course, is essential. Adequate sleep and reducing stress is also very, very important. This will reduce this reducing visceral fat, reducing the weight, reducing abdominal girth, and hip to waist ratio correction will help you to control blood pressure better, control your sugar better as insulin sensitivity can come back, and of course reduce the inflammatory markers and reduce the incidence of coronary artery disease, atherosclerosis, and many other things which are associated with inflammation in the body. This, I can talk about this a little bit more in detail maybe in future videos, but for this, I think the diet, exercise, what to eat, what not to eat will be great help. Thank you for watching. Please start your diet and exercise today. Have a nice day. If you like, please subscribe and let me know your comments. Thank you.